of my anesthesia video. So this is gonna basically go over how we check in a patient for surgery. We are mostly a paperless practice, so everything is done on the computer. Like for estimates, we have an iPad that people sign. As well, if clients have the VCA app, they could also look at their estimate on there, and they can sign it on there. As far as I'm going to use my own dog for an example for how we check patients in. So when my dog got spayed, she was 3 years old, so she was a 3-year-old intact female beagle. She didn't really have any underlying issues, health concerns, anything like that, but we definitely do take those into account. If somebody, has something going on or they need their meds kind of changed, the doctor handles that. So as far as our system, this is what our charting looks like. So if we go to documents, this will be everything that they have ever had. So if they had any previous records, we scan those in. If we've ever sent out any x-rays, those go in there. So this is what I signed for her treatment plan. So this is everything: her spay, all of her anesthesia, pain meds. We always recommend to do laser therapy. She went home with a cone. So we go over this with owners every morning upon check-in. If they have any questions, we can go over it, and then they sign, they initial and they sign here at the very bottom. And then as far as cage cards go, we go back to here, and up in the corner we have this little button over here that pops up, and then we can print cage cards. So not only do we print cage cards, but we also print the paper collars for them to have, just as an extra little step. We get their weights in the morning. They get labs done before they come. So for example, she had labs done here, and it was her heartburn test, and it kind of went over everything that she needed for surgery. And as long as all this comes back okay, that is when the doctor, either we do normal drugs or they modify any drugs, stuff like that. We typically use Antec because VCA works with Antec, unless there is a special reason for blood work to be done the morning of. We typically go off the Antec sheet that we sent out, or their blood work that we sent out at their pre-surgical appointment about roughly 2 weeks before their actual surgery is scheduled. As far as an anesthesia monitoring sheet, this is what it looks like. So we just have like an Excel spreadsheet that we type everybody's info to. So as you could see, it's her name, her patient number, how much she weighed that day, all of her TPRs for the morning from Dr. Benson. She was in ASA of 1, which is great, and then it just has all of our information. It has, what kind of catheter she got, where it was, how many liters was she on, and then all of the anesthesia information. Everything is calculated for us with our spreadsheet, and then sometimes we, depending on the patient, we can always change those, and those are documented there. And then as far as monitoring for surgery goes, that's where everything goes down here. Discharge instructions for her, if we go back to here, discharge instructions would be in her care instructions because she was a spay. So as far as discharge instructions go, we always send owners home with written instructions, whether it was a spay, neuter, dental procedure, anything like that. So it goes over what kind of food they can have when they get home, when they can get their food on the way home. We really go over with owners, if there's any loss of appetite, any refusal to drink any water, vomiting, diarrhea, depression, from surgery to call us and let us know right away. Of course, with the spay, you know, we are restricting exercise for 14 days. We need to recheck the incision in 14 days. We really stress to owners, you know, no activity for spays and neuters. And then, you know, just watch the incision site for any swelling, drainage, bleeding, redness, anything like that. If anything like that happens, call us and let us know. She did go home on pain meds, which was Rovera. It was just 1 tablet twice a day. She started it the next evening with dinner. With Rovera, we always make sure to tell our clients that, you know, if any vomiting or diarrhea occurs, call us and let us know right away. Stop giving the Rovera. Anything like that. So we always send written instructions home with owners, and then they are more than welcome to call us if they have any questions, or if they have a question that wasn't answered with the handout, anything like that. Okay, this is Venus. She is a foster for one of our technicians. She was found as a stray, and she had a very severely broken leg, so she's a tripod now. But we are going to demonstrate blood draws. So for cats, for a jugular blood draw, you can do it 1 of 2 ways. If she wants to play, then we can just do one of these things and get my hands out of the way, and my other tech can draw. Or if with cats, sometimes they want to kind of bat at whoever is drawing blood. So for that, I know this. We would kind of hold her like this with her head up, and then I'd grab her feet like this, and then the other technician could draw that way. As far as a cephalic vein, for a cephalic vein, we can do that standing or laying, whatever she wants to do. So since she's so small, I don't have to hold her like a dog. I can just kind of hold her with my hand like this, and then we're gonna put our, right behind her elbow so she can't jerk back, and we're just gonna roll our finger along the top of her leg to get that vein to pop out, and the technician can draw. And then for a saphenous vein, like I said, she's a tripod, so we're fear-free, so we try to scruff as little as possible. So she can actually sit sternal, and it's a little easier since she's a tripod now, because I don't have to hold that leg back. But if she had all 4 legs, I just have my fingers securely around, kind of right behind her jaw, so if she tried to turn, she couldn't. She would run into my fingers. So if she had her leg, I would just pick this leg up, and then you just kind of, the other technician extends this bottom leg out, and then I just kind of hold off here, apply pressure, and that'll pop that vein out so the other technician can draw. Good job, sis. I know. Complain, complain, complain. Okay, so again, this is Venus. We are going to put her e-collar on her. Like I said, she had a right rear leg amputation, so she's needed an e-collar. She's about 3 weeks post-op, so she's been really good about not messing with her incision when she's supervised and stuff like that, so she hasn't had to wear it, but for the video today, she does. So these are our cat e-collars. We don't have to put these ones together. They already come together, and they're kind of like a thick, like plasticky material, and they already have ties on them. So in order to put an e-collar on, we're just gonna kind of hold her head. I know, we hate the e-collar. And we're just gonna kind of slip that over like that. And then when you tie the e-collar, you want it snug so they can't, kick it or get stuck in it or anything like that, but you still want to be able to fit 1 finger underneath. So I know you hate it, sis. I'm sorry. I know, wait. Okay, so that's tied. A good test too is just to kind of tug on it to make sure it's not going to slip over the back of their head. And like I said, I know, 1 finger, she fits. And that's how you put on an e-collar. teeth. Okay, so this is demonstrating how to do TPRs and then listening to the heart and lungs and assigning an ASA score. So TPRs are temp, pulse, respiration. So of course you take the temp rectally. For the respirations, you can kind of watch, or you can kind of hold the abdomen lightly and feel it go in and out. Sometimes cats, not so much, but dogs are either panting or they're trembling really, really hard, or they're just sniffing everything in sight, and a respiration is really, really hard to get. And then for pulse, there's a couple things. You can either just listen, you can listen to their heart and make sure you don't hear anything that's odd while you're counting heartbeats. And then so you would count them for 15 seconds and multiply by 4. And same thing with respirations. You can count them for 15 seconds and then multiply them by 4. So for the heart, you either want the patient standing, or even cats like to kind of mush into like a bread loaf, so even sternal. So you want to start on the left side and you just kind of listen, make sure the heart sounds okay, and then you'll move over to the right side, kind of right under their armpit, and listen to the heart that way. And then for the lungs, for small dogs and cats, you go in an H pattern. So that meaning it's like here, like right behind their shoulder, here, and then in the middle, and then up into the bottom. And then same thing on the other side. So we're here, to the bottom, to the middle, and then we're up, and then to the bottom. To assign an ASA score, it depends on the animal. So if it's a normal healthy animal with no underlying conditions, they get a score of 1. They don't really have a lot of risk. If they are an ASA2, they have some underlying condition, whether that is just a mild medical issue, if they're obese, they're too skinny, stuff like that. Level 3 is like a moderate kind of disease, kind of right in the middle. And then 4 is going to be a more severe disease, so like a life-threatening disease. If they go under anesthesia, that it's a possibility that they could possibly die on the table. And then a Schedule 5 is going to be that they're going to die without the surgery, but they're still very, very, very high risk. All right, sis, you want to do your TPRs? See this? Okay, so let's do your heart. Hang on, come here. All right, let's do your lung. Hi, girlfriend. Top rear. I know, hang on. Bottom of that H pattern. All right, we gotta do the other side. Come here, sis. Okay, so that's how you do heart and lungs. She is aggressively purring, and I can't get her to stop purring. But so far, there's no sounds of crackles or any odd lung sounds. Her heart is from what little I could hear of it through her purring, is a nice little lub dub, lub dub. And then since I couldn't hear, I'll just take her pulse this way with her femoral artery. Flick, 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 Get girlfriend. Okay, so 156. We can't wish, ma'am. Hang on. Respiration for 15 seconds. Okay, so she's at 36 for respiration. And we're going to attempt to take a temperature rectally, but most of the time we need help with that. So I would need another pair of hands. Come here, girlfriend. I know. Hang on, come here. I know. Want to roll over? There you go. Hang on, Venus. I know. Okay. She's not going to let me do her temp without another pair of hands. I don't blame her. But if she would to come up with a fever, the doctor would need to know right away, and we would possibly postpone surgery if she had a fever, if her heart sounded odd, or if her lungs sounded weird. So, and that is how you TPR, listen to heart and lungs, and assign an ASA score for a kitty cat. So like I said, she has no underlying conditions. She's a pretty healthy girl, so her ASA score would be 1. Okay, so this is TPR on a dog, and this is Zoe. She is my beagle. She's the bestest girl. So same thing with cats. TPR, pulse, temp, and then respirations. So same thing kind of applies. Zoe's a small dog. She's a little easier to see as far as like listening to the heart and lungs. So, hi baby, since she's a small dog, we're gonna go in that H pattern. So for her lungs, we're up here, down here, in the middle, and then up and down on both sides. Heart rate, she's gonna be standing. So then we just go right on the right side, like right under her armpit, listen there, and then right under her armpit, and listen on that side. And then we'll take her temperature rectally too. Same thing applies to dogs for the ASA score, whether they're perfectly healthy with no underlying conditions or anything like that. So Zoe does not have any underlying conditions. She's a perfectly healthy 3-year-old beagle. So as long as everything checks out on her pre-surgical exam for her heart and her lungs and her temperature, as long as she doesn't have a fever, she would be assigned an ASA score of 1 because, again, she doesn't have any underlying conditions. So come here, Zoe. You're a good girl. You want to see this? Okay. Come here, baby. Heart rate on this side. Speed you up. Okay, heart rate. One. Okay, so she's 120 for her heart rate, and she is 30 for respirations. Good girl. So last but not least, we'll temp her. And every time you temp, you just want to use a little bit of lube. Works a little easier. All right, come here, Zoe. Good girl, baby. Good job, though. Okay, she is 100.2. So everything is within normal limits. Like I said, she has an ASA score of 1 because she has no underlying conditions, concerns, no respiratory issues, no nothing like that. All of her blood work came back great, so she is good to go for surgery. You're okay.
Nope, it's all right.
You're okay.
Oh, no, no. No, we're talking about that one lady that comes in. Janice is, do you like her? No. I like, you know, I'm pretty
Good job, Bubba's. Please stay.
Good boy.
Go back. Hang on. Hang on. With Tyson, yes. Good job, Bubba. I'm sorry. Good boy.
Good
Kitty me.
boy.
I don't know if he's gonna have staples or sutures or anything. You guys just
You're okay.
Nope, it's all right.
You're okay. Okay, cephalic blood draw. Boy, Egon. Good boy, Bubba. All right, he's diabetic, so we're gonna check his glucose real quick. Jugular blood draw. Bubba, let me see your nipple. Good boy, up. Good boy, Roscoe. Good boy. You know, his color change and his colic are dangerously close. Good boy. Good boy, Roscoe. Good job.
doing okay, Beth?
Good boy, that's it.
Good job.
Okay, cephalic blood draw. Boy, Egon. All right, he's diabetic, so we're gonna check his glucose real quick. Jugular blood draw. Hey, Bubba, let me see your nipple. Good boy. Good boy, Roscoe. Good boy.
No, his color change and his colic are dangerously close.
Good boy, Roscoe. Good job.
Doing okay, Beth?
Good boy, that's it.
Good job.
Okay, so this is a cephalic blood draw. This is Zoe. She is my doggo, and she's kind of a pansy for pokes. So we're just gonna spray her with some hexacane and kind of numb her up a little bit. And then since she doesn't actually need any blood work done, it's just a small TB syringe. Good girl, Zoe. And there's our blood. Okay, so this is my Saccharinus straw. I know. Wait, baby, wait. Okay, hang on. That's it. That's all we needed to do. Good job. And we're in, and there's our blood draw. Okay, so our book talks about all of the different kind of tests that we can run to look at the blood and kidney levels, liver levels, stuff like that in-house to make sure candidates are good to go for surgery. So a couple of them are like packed cell volume. You can look at like the BUN level. You can look at specific gravity for urine and do urinalysis, stuff like that. So here in our clinic, 9 times out of 10, we send everything out to the lab because Antech does all of our testing, unless it's pertinent that we need it right now and we can run it in-house. So in-house, we can do urinalysis. We have a urinalysis machine that reads, but we also have the dipsticks with the key on the back of the tube. We can do CPLs, FPLs, we can do PT, PTTs before surgery. We did a buccal membrane test the other day right before surgery to make sure a patient was good to go. We can do CBCs, vet scans. We can do the packed cell volume, total solids in-house. We don't do that too much, more so the vet scan and the CBC, and the vet scan gives us all like ALT, BUN, creatinine, stuff like that. With kind of extras that we have, if we find something odd in exam, all of our doctors can do ultrasound, so we can look at you know, the abdomen or the chest for ultrasound. We have radiographs in-house, so we can do that, chest, abdomen, whatever we need to look at. And then we also have we can do ECGs here. Our EKG machine is currently broken, but we have one on order, so we can do that too. So we have quite a few options on stuff we can do for surgery candidates. But like I said, as long as everything is normal, they haven't had any issues or anything like that, 9 times out of 10, it gets sent out to the lab, and the lab does it all, and the lab sends back our values. Okay, so the pre-anesthetic protocol that we use at the hospital for cats is buprenorphine, ketamine, and dexdomitor. And then for dogs, it's Dextorb, and then we'll induct with propofol. So pain management wise, everybody gets, for soft tissues, everybody gets an injection of either Onsior for cats or Rimadyl for dogs, even for dentals if they're having teeth extracted, they'll get those as well. And then everybody goes home with pain meds. So for soft tissues and extractions, cats will go home with 3 days of tablet Onsior that they start the next morning. And then dogs usually go home with Rovera unless they have something going on where they can't have Rovera, and then they'll go home with the appropriate pain medication depending on what's going on with them. So usually those are the 3 we stick to. Sometimes we'll use hydromorphone, but that's if the doctor deems it, and B, if something's going on. So the doctor will look at the pet the morning of surgery. Typically they have a really good idea of who the pet is, what their history is, you know, if they have any kidney issues, any liver issues, if they've had issues coming out of anesthesia before, anything like that. And then we can modify, usually it's the DEX we modify. Sometimes we will X the DEX altogether, and we'll use hydromorphone. It just kind of depends on patient by patient, but typically it's the Dextorb and propofol for dogs, and then buprenorphine, ketamine, and the Dex for cats. And then everybody gets a Cerenia injection as well to help with nausea. Recently we have been trying to do sending Cerenia home at their pre-surgical appointment, so the owner gives it the morning of, so we don't have to give it sub-Q in the morning, but either way is fine. Okay, so this is my controlled substance log for gabapentin, 100 milligrams. So you always want to fill out your controlled substance log with a black or blue pen, or otherwise the controlled substance people get a little angry. So to do that, we open to our blank page, our next available box. So today's date, 1/21/22, and then we have stickers that we put in our logs. So we put that in the box. And then our dispensed amount was 60. We didn't administer any because we sent them home. So do the math. 418 minus 60 equals 358 is what's left in that bottle. I'm the dispenser, so I sign my name. The girl that double counted it, she's in an appointment, so she'll sign it here in a minute. And then I give it to the DVM for them to sign up in this little box up here. And then I have to write the bottle number, which was 2115A. So that's what our controlled substance log looks like.